Welcome to Chamber Chat. I'm Stephanie Ford. Today we are chatting with Dr. Mark Duber. He is an orthopedic surgeon at AdventHealth. Welcome.
Thanks for being here.
Absolutely. He has a very impressive background, over 20 years experience in his field, including serving in the 772nd Forward Surgical Team in Afghanistan. Thank you for your service.
Thank you, appreciate it.
Tell us a little bit more about your background and what it is you do at Advent.
Yep. So originally I'm from Cleveland, Ohio. I did my training at the Cleveland Clinic Health System. Once I finished, I was in the U.S. Army for about 14 years. I served as an orthopedic surgeon. Once out, I took a job in Kentucky, and then from there we moved down to Florida.
Fabulous. A lot of great experience. And now you're here with us in New Smyrna Beach, Florida. Is that where your office is located?
Yep, my office is located at AdventHealth in New Smyrna Beach.
Great. And what are some of the sort of orthopedic surgeries you perform, or tell me a little bit more about that?
So I would break my surgical skill set into multiple different layers here. One is joint replacement. I do anterior hip replacements, robotic knee replacements, reverse and total shoulder replacements. I also do sports medicine, and then lots of smaller surgeries like endoscopic carpal tunnel release.
So not much. He's not very busy, it sounds like. That's great. You mentioned a couple of things that interest me. So you said robotic knee replacement. Is that a new, having the robot, is that new at Advent?
So that's a type of surgery that I'm going to be bringing with me to Advent New Smyrna Beach. We're in the process of purchasing the robot now, and in the months to come, we'll have that robot at New Smyrna Beach, and we'll be the first ones doing robotic knee replacement at AdventHealth New Smyrna Beach.
Very cool. And hip replacements. So let's talk a little bit more about this. How do you know if you need a hip replacement? What are some of those signs and symptoms? At what point do you go to a doctor or reach out and get that checked?
So hip replacement is related to hip arthritis. Hip arthritis is pain based in the groin of your hip. It's not the outside or the backside, it's more the groin. And when that pain becomes so unbearable that it's affecting your activities of daily living, it's affecting working out, walking, or doing things that you love to do, then it's something that needs to be evaluated. When we evaluate a patient, we usually start with an x-ray, a physical exam, and we try to get an idea how bad the arthritis is. If the arthritis is significant, then we start leaning towards hip replacement. And the type of hip replacements I do are anterior hip replacements, which we could talk more about. And then we also determine where else could the hip pain be coming from. If it's in the back side, typically it's something related to the back or muscular. If it's on the side, we call that bursitis typically. But we're looking for the groin pain, and if you fail all conservative care, which can include injections, physical therapy, anti-inflammatories, and activity restrictions, then we start leaning towards the anterior hip replacement.
Okay, so quite a process to go through. You eliminate all other factors, and then hip replacement might be the best option from there. So what is that procedure like, and what does that recovery look like?
So anterior hip replacement is a new type of hip replacement that's been done mostly for about the last 10 years. It's a quicker recovery. Typically the surgery takes about an hour. People go home the same day when we do those hip replacements. Wow. It's not our grandmother's hip replacement. It's the newer version. So I would say that we have less blood loss, quicker recoveries in terms of most people are going back to work by 6 weeks, and that could even be in a store walking. It's a very, very fast recovery. And hip replacements in today's day and age, if they're done appropriately, can last even up to 30 or 40 years.
Oh, wow, that's great. What would you say is the average age for those patients that you see?
So average age is typically somewhere between 50 and 65, I would say, is the average age for a hip replacement currently.
Okay, gosh, that seems so young. I also seem so close to that age range now. So you mentioned arthritis of the hip, bursitis of the hip. What is the difference between the two?
So the number one difference is a location. So bursitis, which means it's an inflamed fat pad, is the most common reason for hip pain, and that's on the outside of your hip, on that bony bump.
Okay.
Arthritis, which is the ball socket joint, that pain is specific to the groin itself, and that's typically a sharp stabbing pain.
And that's more specific to the surgery you were talking about?
Yeah, so when we talk about hip replacement, specifically anterior hip replacement or any type of hip replacement, we're basing that on groin pain, the pain caused by the ball and socket, which is usually a lack of cartilage in the ball socket, and that causes a bone-on-bone grind, and that causes that pain.
That sounds extremely unpleasant.
It's very unpleasant.
How do you, can you mitigate getting bursitis or arthritis? Is that preventable, or once you have it, is it something that you just live with?
Yeah, so arthritis generally is something you're going to live with.
Okay.
Because arthritis, and what arthritis is a loss of cartilage in the hip joint, would be at the ball socket joint. Bursitis is just inflammation. So we can take care of bursitis with injections to calm that inflamed fat pad down. We can do physical therapy. We can stretch the band of tissue on the side, which puts pressure on it, and then physical therapy and or anti-inflammatories. So bursitis, generally, we can fix that, okay? But arthritis, once that process starts, it never gets better. It only gets worse over time.
Gotcha. So that IT band, doing a lot of stretching, that will help with the bursitis. And then arthritis is just sort of like, how do you mitigate the pain and then determine, is it bad enough for surgery would be the last.
Yeah, so arthritis, the whole point of when we get to the point of hip replacement is, have we done the conservative care measures? So physical therapy, typically we're looking for 3 months of physical therapy, and that's really directed by insurance.
Okay.
Anti-inflammatories like the ibuprofens, the Aleve, or the prescription-based anti-inflammatories. We also look at hip injections. Sometimes we can inject a hip, and that can calm it down for 3 to 6 months. And if we can buy time on the hip, then we try to do that. A hip replacement, just like any replacement, it's an end stage, it's the last resort. We want to know that you've gone through the whole process before we get to that point.
Gotcha. So would you see primary care physician to determine bursitis or arthritis, and then would they treat one of those versus the other?
Well, generally primary care is going to try to treat it, mostly with anti-inflammatories and physical therapy. And in the perfect world, you would have done those with primary care. They would have gotten to the point that they failed, and then the referral happens to come over to us. And then we check the process of what you did. And if we got to the end stage of it, we would start talking about hip replacement.
Anything else you want to share with us about your practice or AdventHealth or what you do there?
So I would just say that we have a very diverse practice. I'm also very involved in sports medicine. I'll be working with the local high schools for sports medicine. We'll actually be using my clinic as a walk-in clinic for the first hour of every day of our clinic for sports athletes. So sports is very important to me. I've been involved in that, especially with the Army. So I try to keep my sports practice going as long as the joint replacements.
Awesome. That's a great service to the community. AdventHealth is so involved in the community, and we hear a lot from them about whole person care. Tell us how this ties into what you do and your practice.
So in terms of arthritis and any type of replacement, the whole care philosophy is that a patient's coming in, every patient is unique. They're their own individual. So we want to look at them as a complete person, look at where they've come, what they've done, and really form a plan specific to them.
That's great. What are some of your personal interests or things that you like to do here in New Smyrna?
So I have lots of hobbies, sometimes too many, but I'm an instrument-rated private pilot, so I fly out of New Smyrna Beach Airport. I'm actually a wingsuit skydiver. I've been skydiving for about 15 years, scuba diver, and then very involved with my 4 kids in travel sports, traveling all over the United States.
That is awesome. My brother-in-law is a pilot, private pilot as well. Such a great skill. It's always great to know a pilot. Comes in very handy. That's fantastic. And then obviously that ties in your passion with sports medicine and being involved. Did you play sports when you were younger?
Yep. So in Cleveland, where I grew up, I played ice hockey and I ran track and then football.
What is ice hockey? We're not familiar with that here. We don't have a lot of that. That's fantastic.
Yep.
Well, we certainly appreciate you being here. Lots of great information. And then how do we find out about where you're located or how to contact you?
So the best way to contact us is just to call the office, and we can put that phone number up. And then just call, make an appointment, and let's evaluate everybody as a patient and see what's going on.
Great. And we also have the website available on the screen for you as well. So thank you very much for being a guest. Thank you, AdventHealth, and also Shark City Media for producing this content.
Thank you.